out there in the prep area. Just like with your car, don't overfill. You don't overfill with oil, it'll ruin the engine. Okay, fall somewhere within those two lines. All right, so now we're going to hook up our pad to the pump. Okay, next step, very important, and that is to open these valves, release these valves. If you fail to do that, this pump is going to be trying to pump water into the blanket, and it's not going to go anyplace because of these valves. What you end up doing is burning out the pump. And these things, that thing costs like $400, okay? So make sure you open all the valves, and you've got to open the two on this hose right here, and I try and move them off of that little kinked portion of the hose, so make sure it's adequately opened. And then you've also got to open these two little valves on the blanket itself. Okay, so make sure those valves are open. Every semester I come in, check it, and the machine's running and valves are closed, running the machine. All right, it's on standby. As soon as you plug it in, you press this button to turn it on. The default position will circulate 100-degree water. If you have an animal that's really hypothermic, you can bump that up to 107 degrees. Or, which we almost never do here, if you have to cool an animal, you bump it again, now you're down to 50-degree water. You'll actually be cooling your animal rather than heating it. Most of the time, like I said, it's going to default to that 100-degree temperature. But this thing doesn't heat up instantaneously. It takes a while to heat up the water. So if you're planning a surgery and you're out there getting your animal ready, someone needs to be in here turning the heat pump on, 5-10 minutes before you anticipate bringing the animal in. Otherwise, they're just going to be putting them on a cold water pad. So think ahead, get that going. All right, next thing we're going to do is we're going to cover our water blanket with a towel. Now we're ready for our patient. Now we need to tie in the legs. And this is another place where people end up doing it wrong. If this is, and again, they made this so cheap. If this is the dog's hock right here, what we want to do is we want to put the first loop of this rope above the hock, proximal to the hock. And then you put a half hitch here, distal to the hock. Like that. What we're trying to do here, if you didn't put that second loop there, you'd be putting all of the pressure on that first loop, and it could actually shut off blood flow to the lower limb. You act like a tourniquet. By doing the two loops, you kind of more evenly distribute the pressure, and you don't tend to have that constricting effect on blood vessels. So that's leg one. Second hind leg, first loop above the hock, half hitch below the hock. All right. Now, if you come down here, your strings have to go to the inside of this black knob. They have to be on the inside and then attach to the cleat. Okay. Did you do that on that side for me? Go to the inside of the knob and then attach to the cleat. Oh, that should be plenty. All right. Now, the reason for that is we usually tilt these animals for space, at least I do. We tilt them like this. And we're going to depend on those strings to keep our animal from sliding off into the anesthetist's lap. Now, if you do it incorrectly, which I see done every semester, you don't go to the inside of the knob. You just come out here like this, to the outside of the knob. what's going to happen at some point, that string is going to slip off. And there goes our patient. So make sure inside of the knob, not to the outside. As far as the front legs are concerned, we're typically tying those down just in case this animal should wake up from anesthesia and start paddling. And we just want to have control of those legs in a potential emergency. We're not trying to tighten these legs up. Again, first loop above the carcass, half hitch below the carcass. And then these legs are just very lightly tied. We don't want to stretch this animal out like that, because if you do that, they can't breathe. They can't expand their chest. This is just very lightly tied. In case they wake up, we've got some control of the legs. Now you see some practices, they like to cross the legs. Anybody been in a practice that likes to do that? Well, boy, that's like the effect. That's like crucifying, right? You cannot breathe. So don't cross the legs. Just a very light tie on the front legs. And you'll notice if you have your IV catheter in the leg vein here, in the cephalic vein, you really can't put that first loop above the carpus. In that case, you're only going to have to be able to put one loop below the carpus. Otherwise, you'd be cutting off that the flow of fluids in that vein. But again, it's a very light tie. It's not tight. All right, let's go over the operation of the table, because I'm stunned by the end of the semester. And I'll tell you, everything is going to be on the final exam. I'll tell you, every question is going to be on the final exam before you take it. One of them is going to be to take Resuscitate Dog here and position her properly on the table, just like we've done here. And I can't believe it, after an entire semester, we come in and people, they're looking at the table, they have no conception how to work the table. I don't know how you can make it through an entire semester and never figure out how to work the table. They've passed organic chemistry, they've passed calculus, but they simply cannot cope with figuring out how to work the table. So let me show you, all right? You got two controls here. This one controls the horizontal elevation of the table, and this one controls the angulation of the table. If we want to raise the table or lower it, first of all, we have to loosen this bolt, okay? And you only have to do one or two turns. I've seen people keep turning this thing. Eventually the bolt falls out on the ground. We got to put it back in. All you need is one or two turns to loosen it. If we seek to raise the table, you simply press on this pedal right here. I think it's already at maximum height, so let me just let it down. If you want to raise the table, you just pump that pedal right there. If you want to lower the table, you have to simultaneously step on that pedal and that lever arm right there. If you do that, then the table goes down. And once you've got it to the appropriate height, make sure to re-tighten this bolt, because if you don't, I'm going to come in here and I'm going to walk up to the table to do something, and next thing I know, the dog's going around like a merry-go-round. So make sure you re-tighten that bolt. All right, this second one here, this controls the angulation of the table. In order to put them at a 45-degree angle, that's called the Trendelenburg position, and for spays, that's what I like. I like all of the viscera to go to the forward. That just makes it easier to do the surgery. All right, you undo this bolt here, and then you're going to have to lift the table up to whatever height we want it. Now, I like a 45-degree angle, so think of a 45-degree angle, and then you have to tighten it, and that holds it in position. Now, when we're all done and we want to bring the dog back to horizontal, how do you do that? Here's what you don't do. Just come up here and loosen the bolt. I don't know about you, but I wouldn't want to have that happen to my back, okay? You've got to control it, okay? You've got to have control of that table. Ease it down. Okay, any questions?